Vestibular therapy may not be something you've heard of before, but it is important.
That's right, and Mekayla Murphey from the Rehabilitation Hospital joins us to talk all about it. So, good morning to you, Mekayla, and thank you so much for being here.
Thank you for having me.
Oh yeah, it's early. So exactly what is vestibular therapy? I mean, can you kind of explain the back end of it, why it's even a therapy for patients?
Well, vestibular therapy helps to treat patients who have problems with vertigo and dizziness, and over time we've come to figure out that so many people in the population or in the general population usually have a bout of vertigo or dizziness at one point in time in their life. So as physical therapists, we just thought that it would be something that we can add into trying to just keep patients and keep people doing well so they can go about their normal day.
Keep a smile on their face, right?
Yes. And try not to keep the world so dizzy and everything,
Right,
keep them bouncing up and down, you know, being able to just walk and do your normal activity without feeling just
weak and
just
out of order.
And out of balance. Does have something to do with balance, and that's what physical therapy also works on, balance. So once you're off balance, it helps to just get everything back in order of your normal day.
Yeah, that makes a lot of sense, and I know that, of course, we've all been dizzy, I think, at one point or another, but there's a difference between just being dizzy for a few seconds and having vertigo. Vertigo is sort of a more serious condition, right? What is that? Vertigo is dizziness due to having a vestibular inner ear problem. There are things that once you can have a viral infection of the inner ear, like a sinus infection, that will sometimes still leave you a little bit dizzy. And it kind of just, because you haven't, even though you've taken your antibiotics and your medication, you still have an inner ear problem that needs to just be relocated and be, that's where the vestibular system is located, in the inner ear. So it helps to just try to get your system back in order. So basically in the inner ear, it's your balance, like it controls your balance.
Yes, it controls your balance and your velocity of how fast you're walking, and just where you are in your position in space.
So how many people do you treat over there at Navicent? I mean, how many people come to the therapy?
So far we've had about maybe 10 to 15 patients with vertigo that I've seen and treated. Usually we just get a referral from the physician and that says dizzy, and then you kind of go from there to figure out what type of treatment you need to attend with.
So that means you kind of don't have a lot of people that have this issue, but it's still needed.
Yes, it's still needed because a lot of people don't realize that they have a problem with dizziness, that it is an issue and it is an inner ear issue, that you continue to take your different type of medicines and antibiotics, but you're still not fixing the true whole problem.
The root of the problem,
yes.
right.
Exactly. Well, Mekayla, thank you so much for being here today. Learned something new today. I know I certainly did.
Yes.
And, definitely good stuff. If you want more information about vertigo or vestibular therapy, you can go to our website, 41nbc.com.
And Dean